Thank you very much. I'm Dr. Dan Eli Aniku. I'm an obstetrician and gynecologist. With increasing incidences of obesity in general population and consequently in pregnant women, the importance of exercise cannot be underestimated. In this podcast, I want to discuss with you about benefits of doing exercises in pregnancy, which exercises are safe, which exercises should be avoided, and in which conditions you can do exercises, and in which conditions you should avoid doing exercises, and then in which situation you should stop doing the exercises, assuming you are developing some complications. Physical exercises, they help in improving cardiovascular function of the mother. They help to reduce the risk of obesity and diabetes. They also generally help to improve longevity of the mother. It is very important to introduce physical exercises during pregnancy. And before exercises are started by mothers, it is important that they are examined, and it is recommended that they should do exercises according to the conditions in which they are. As I told you before, there are conditions where there is an absolute contraindication to doing exercises. For example, if a mother has severe anemia, if a mother has severe preeclampsia, if the mother has multiple pregnancy which is at a risk of preterm labor, if a mother has had maybe a cervical cerclage or history of cervical incompetence, if a mother for some reasons has got a placenta previa, especially above 26 weeks, if a mother has had other heart or lung conditions like a restrictive pulmonary condition where the lung capacity is limited, we would not want mothers in such situations to be able to do any physical exercises because they need to be observed. Meanwhile, in some cases, the decision to do exercise is relative. There are patients who have relative contraindication. For example, if a patient has mild anemia, if a patient has poorly controlled type 1 diabetes, if a patient for some reason is a smoker, if a patient is morbidly obese. When we talk of morbid obesity, it means the BMI is above 40. If a patient is extremely underweight, if a patient has poorly controlled seizures, if a patient has poorly controlled pressures, and if a patient for some reason has an orthopedic condition, in such patients you need to evaluate them on one-on-one basis. You may not give them an absolute blank check that they can be able to do exercises. The exercises which we consider safe in pregnancy, such as walking, jogging, yoga, swimming, stationery, bicycle riding, all those are very safe exercises to consider while you're pregnant. Meanwhile, there are certain exercises which we do not advise mothers to engage in, such as soccer, such as hockey, such as rugby. So any activity where the mother is at risk of falling, would not want the mother to participate in such exercise activities. Meanwhile, there are situations when if a mother is already doing exercises, you would encourage her to stop. If one, she's had history of bleeding, on and off bleeding, if a mother develops a ruptured membranes. If a mother reports dizziness, quite often reports headache, muscle weakness affecting balance, patient has chest pain, in all those kind of exercise, in all those conditions that arise, you would encourage the mother to stop exercising. So as I told you before, exercise is extremely very important in pregnancy. It improves the cardiovascular function of the mother. It helps to prevent mothers from getting obesity and diabetes. And it also helps mothers in the long run longevity of the life. Thank you.